Hello. I have a very interesting topic. I know all my topics are interesting, right? This one is controversial, very, very controversial. The G spot and the P spot, or the male G spot. I call it the P spot, okay? So the male G spot, the P spot is the same. Do they exist? All right, y'all. Come on, guys. Does the G spot exist? Does the P spot, the male G spot, exist? All right, we're going to talk about it. So, I believe they do exist. I have several patients that I have, you know, treated over the years, and I tell you, both male and female, they do exist. The question is, what are they, right? So, the G spot, let's go with the men, female and men. I'm going to go together, the male and the female. I love to do that. Go back and forth. So, in the female, the G spot is really an area, again, an inch and a half to 2 inches to 3 inches in the anterior vaginal wall. All right, it's a little area there that we notice when women are aroused. It tends to be exquisitely sensitive and an erogenous zone. Okay, so we call that an erogenous zone because when you locate it, you are going to be in heaven. Okay, both you and your partner, the male and the female, all right, or the female and the female, right? The equivalent is the male G spot or the P spot, which I love, which is really, I'm going to start calling it the male G spot because I know literature studies call it the male G spot. I just call it the P spot. But the male G spot is the equivalent sort of to the G spot in the female because they both come from sort of, the same tissue. Okay. So the G spot comprises a few things. Okay. First of all, it does happen to have the scalene or the Skene glands. Okay. So the Skene glands come from the prostate. Okay. And I'm saying originally when we're born, that's how they develop from very, very early, like 12 weeks into the pregnancy, right? The development of the prostate does not occur until about 12 weeks. And when it does occur, it waits for the androgen, testosterone, the hormones, the male hormones to make it a prostate. Otherwise, it becomes a Skene gland. Okay, so we get that Skene gland lower down in that area where the vagina is, actually where the G spot is. And we actually have other glands and other ducts, including the urethral sponge. That's where that sits too. So they all sit there, okay? Versus on the male side, the male G spot, the prostate develops and turns into that area down in the pelvic area, where in front of the rectal mucosa, the rectal colon, and it sits there below the bladder, and it does its job, which is collect semen and ejaculate when you need to ejaculate. Okay, so we have the both spots coming from the same origin, right, from the prostate, but it turns into the Skene glands in the woman and stays as the prostate in the man. Okay, all right, so that's the first thing I want to clarify. So when you have that G spot in the female and that P spot in the male, I am telling you that when they are stimulated, you're going to get an ejaculation, you're going to get an intense pleasure, erotic pleasure. That orgasm is going to be more likely when you actually locate it and you stimulate it. Okay, so in the men, to get to stimulate it, yeah, you can go to the perineum, which is between the scrotum and the anus area, just stimulate it either with your hands or with some toys, again, depending on what you prefer. Again, ideally, I advise my patients to go up with an anal stimulator because that is what I like to use for patients that have either prostate issues, prostatitis, enlarged prostate that are congested and not draining. I need the lymphatics to sort of like be drained, so I get them to get the prostate stimulator that goes up there and will actually encourage drainage, so encourage shrinkage of the prostate, so there's more blood flow and less problems with the prostate enlargement, which I see a lot of. So again, that prostate in the male is right there in front of the rectal colon. And so the rectal colon is where it lays, but it's below the bladder. So what it does is that if you're able to get through it through the rectum, right, through the anus, you're going to be able to locate that male G-spot exactly on the prostate behind the rectal mucosa, behind the rectal wall, okay? So if you can directly stimulate it, you're gonna have great pleasure, okay? You're gonna have this shuddering, guys. You're gonna have this intense feeling, much more than the penile ejaculation that you get from stimulating the penis. Now, this is an advanced sort of information, advanced sort of course. If you're not interested in the male G-spot location, just go to another channel, right? Bypass me. And if you are, just learn that there are more intense orgasms you can have if you involve the male G-spot in men, and if you involve the female G-spot in women, right? So if you can locate them in either sex, in either person, you're going to be able to find some great pleasure doing so, because it's going to be more intense, even with the women. With the women, when we stimulate the clitoris, masturbation-wise, or even when you're having sex and you stimulate the clitoris, yes, you're going to have a great orgasm, but you can actually have a better, bigger, more spectacular orgasm if you involve the G-spot, okay? So remember, in women, you go in, it's about 1 to 2 to 3 inches anteriorly, and for men, you go in either through the perineum, because I know y'all are shy about going into that anal area, and if you are, I'm okay with it. Just go in through the perineum or go into the rectum, find that the male G-spot. And when you do, you're going to learn with time. You got to be patient, right? You got to be very gentle, because that is where you're going to learn how to now develop a different pathway to your orgasm. It actually is a different pathway. So once in a while, I'll tell you something that is really new, and the cutting edge new information on this is they actually say that, again, research says that the brain actually starts in guys when they're having that male G-spot stimulated, starts to rewire and create this completely unbeknownst to you explosion of these nerves, and the whole body starts to get completely involved in that orgasm, right? Compared to the penile. The penile is great for y'all, right? But the male G-spot stimulation, they say that it is something that is understudied. We're not doing enough studies on it for y'all, because it seems that to do it is very complex, because I think the subject of going into the anal area might be a little bit of a taboo for a lot of people. So they can't get a lot of good studies from, good volunteers. So I think we're going to start working on that pretty soon to try and get a little bit more information, because it actually says, or they actually say, that the more that you're able to release that tension in the prostate, it may, again, don't quote me, but it may reduce prostate issues like cancer and inflammation and prostatitis and actually cancer, right? So again, enlargement, cancer, all these things, any issues, dribbling, all that's related. So you want to improve the function of the prostate by getting it to function well and drain. And yes, the prostate is involved in your contraction when you're having that orgasm, right? So it does contract, and it does allow you to ejaculate. And when you do, if you do, again, depending on the stage you are with your male G-spot experience, the beginners may not ejaculate. You're just going to start very slowly. You have to be patient, right? And you have to learn how to sort of gradually get there. It's not going to happen overnight. I know with the gay sex, they tend to do hit that male G-spot more frequently, which is why I understand they have fantastic sex. But for heterosexual men that are trying to, again, elevate their game, elevate their experience, if you're interested, it can be such a pleasurable experience. And again, the benefits are that you get a more intense orgasm. And you know me, the bigger the orgasm, the bigger the pleasure, and the bigger the circulation around the body, and the heart benefits. Your cardiac muscles will benefit with all that exercise, and the good hormones and good pheromones that are produced that will actually just allow you to get this big benefit of relaxation and happiness and just pure pleasure, which again can prolong your life and de-stress, right? Just get you into a happy place, which we want to do as often as we can, especially when we're under so much stress. So the G-spot in the woman does the same thing, but you've got to be able to locate it, right? Now, with the G spot, we are confused because a lot of studies have been done, and about half of them, have not been able to discover the G spot over the years. But the G spot really does exist because, again, there is an area that if you do not get aroused, you're not going to find it. So it's very difficult to find. And ultrasound studies have found it, right? They've actually found it in some cadavers, actually. So they've done some studies and they've located it. Actually, I said cadavers. No, they've actually located some evidence of it in cadavers, but most of the evidence is in live ultrasound imaging, looking at the area of the G spot while they're having the orgasm. So get that, right? When they're having woman's having that orgasm, they can actually see some sort of denting, right? Some sort of softening of that area of the G spot, which they suspect is the area where the skin glands, the urethral sponge, which again is down there beside and along the urethral path, which is where the urethra, which is where we urinate from in women, comes and lays along that anterior vaginal wall. And then we've got the clitoral nerve there. We have the spongy urethral sponge that gets filled with blood and has a lot of innervations. And then we have, again, other ducts that are there, and they're all there. And the clitoris itself, which we know is long, right? It has the bulb part, right? The leg part that actually will wrap itself around the vagina. So if you can get that clitoris completely engorged, again, from the glans, which is the tip, the opening that you see, you stimulate that, but you also have to stimulate the lips of the vulva, the lips of the vagina. And you've got to also stimulate on the inside of the vagina, because I truly think it's hard to get to that G spot without some manual stimulation. So you can use a toy, you can use your fingers and get to that G spot. So again, guys, gals, to locate that G spot, you've got to get aroused, and you'll feel that softening, that area that just starts to expand, as they say in studies. The clitoris, the urethra, and the vagina tend to just sort of like move downwards and then start to form that G spot. So it's almost like if you try to look for it when you're not aroused, you're not going to find it. You've got to be aroused to find it. So when you're arousing your partner, studies do say that you really want to manually put your fingers there, or with a toy, or even have your lady try to let you know where it is, where when you feel that particular arousal more in a particular part of the vagina, right? So that is what will give you the vaginal orgasm, right? So we have the G-spot orgasm, right, when that is particularly focused on, and that does contribute to the vaginal orgasm, which some people say they never have. So if they're not having a vaginal orgasm, which again, to me, is just an added benefit, you might want to focus on that G-spot and get that G-spot involved, because then that G-spot will connect to the clitoris, right, from the vagina. And if you sometimes hit the glands part of the clitoris, you also get it down to the vagina. So some people are lucky, and again, if it's the more closer they are to each other, remember, you can have those orgasms more frequently. The further away they are, so that anatomy, remember, if the urethra is up here and the vagina is down here, and it's more than, they say, 2 to 0.5 centimeters, that's a little bit too far, right? So, but when you get them closer together, when you get aroused, they should get closer together so that they concentrate, and then all that innervation and all that blood supply and all that engorgement happens, and then that nerve pathway to the brain just goes completely gaga, and you actually feel a lot more aroused. So here's the secret. I know I've said a lot, but the secret is that if you're able to touch, stimulate more than one erogenous zone at the same time, I think you're going to have a much better chance, and studies do show that, of having her have that orgasm. All right, so let's say it again. What we have, the nipples, right? You can be stimulating, right? We have in so many erogenous zones. We have, of course, the G spot, the clitoris, the cervix, right? If you can penetrate the cervix at the same time and find that G spot, right? Or you're hitting when I'm saying hitting, when you're penetrating vaginally, you go from the posterior position, going from the back, trying to aim down towards that G spot, right? And then sometimes you just don't want to go too deep. You want to go a little bit more shallow, a little bit more superficial, because you don't want to go all the way in because you're going to pass it. So you go right where that G-spot is, again, an inch, 2 inches to 3 inches in that general vicinity, and you keep on locating that area and you'll hear her and she'll tell you whether you're getting there. You'll just know. She'll just tell you. Trust me, she'll tell you. But when you go in there, you try and locate that, and then you can do the cervical stimulation by going all the way up. If you want to go all the way up, then the behind the knees, well, that's another nice area that is erogenous, and the calf, the inner thighs, right? And some other people say the ears, right? The nape of the neck, the back. So everyone has their own erogenous areas, the lips, the nose, the sky's the limit. So you really want to be able to have somebody tell you that is the spot. And when they tell you that, then you'll be able to address the G-spot, and then the whole accumulation of all those senses will go to the brain and give her orgasm. Okay, that's what we hope. That's what we want. That's why I'm having this conversation with you. You really want to have someone that's going to tell you that you are in the zone, and she will communicate that with you. And when you're in that zone, her chances of getting that orgasm will be much higher. Okay, so if you are not able to find the G-spot, don't give up, because it does take time. It takes a lot of trust with her. She's going to have to trust you. Sorry, my decoration's coming off. I might whip it off in a second. But a lot of that is coming from her, because she's the one that's going to communicate it. It's hard for you to know without her telling you what it is. So they say the missionary position is not going to cut it. Okay, guys? The missionary position, you cannot get to that G-spot, unfortunately. So it's good for, just a preamble, foreplay, just get it going. And for those that do have orgasms without the G-spot being stimulated, go for it. But those that are not having orgasms, again, we're trying to find a solution. Let's find that G-spot. Let's see whether stimulating that plus the clitoris, plus even some people say the anal area or the perineal area, where people actually feel more sensitive if they have more nerves or more innervation. Now, some people don't have a lot of innervation, so don't go there. If they say don't go there, don't go there. I'm very aware that some people do not want you to go in that area, so don't go there. But it would be nice if they have all those areas stimulated, females and the men too. The men love to be stimulated also. Nipples for guys, the anal area, the perineum between the scrotum itself, the sac itself, the testicles, all that for the women. You need to also stimulate that too, especially when you're trying to give them the pleasure that you want them to have, which is a little bit different each time. So if you're going for the male G-spot also, you want to get that all involved, because they're going to be appreciative. And yes, I do think some guys do have nipples that are not sensitive, so you leave them alone, and some anal areas that will not do anything for them, so just leave them alone also. But for those that are interested, or if they don't want you to go to the anal, you can go again in between the scrotum and the anus where that perineum is, and you can just use either a toy or your own hand or your fingers to sort of sensitize and make them more sensitive in that area, which you will know whether they respond to or not. Okay, so with women, the yoni massage. Have you heard of the yoni massage? That is where women probably will tell you when you're trying to massage, you're trying to get into that area. Again, just go do some research on that. There are people that will specialize in that. And you guys, I know some of you guys know how to do it, but the most important thing is for you to learn how to locate that G-spot. And the yoni massage is one way of doing it. I would love if you would learn that and get that technique down pat, so that you'll be able to have her have that orgasm much more likely. And again, not just one area. We want multiple. And I know it's not easy, guys, but you want to try and see what areas. The nape of her head, the nape of her neck. Is it her hair, pulling her hair? Is it being more aggressive? Is it being less aggressive? Is it being more gentle? Is it talking? All those different sensations, all those senses that are involved will increase the chance of her having that orgasm. Okay? All right. So locating the G-spot in the woman, I said you go in, you try and do that massage, try and locate it, but she's got to get aroused. You're not going to really find it unless she's aroused. And then you're going to involve the other erotic zones, like I mentioned earlier. And then we'll try and see whether we can get her to have that orgasm, right? But remember, the ambiance, the environment, your attention to her, all that matters. The foreplay, all that matters. So you might not get it the first time. It might take time, because she's trying to trust you. She's trying to get to a point where she can relax with you. And then if you keep on going and don't give up, you will get her there. Okay. And again, get the hormones checked. All right, ladies, get your hormones checked. If you find that you're not getting a lot of relief from that stimulation, if you find that you are not getting aroused, come see me so I can check your hormone levels. Okay. All right. And for guys, I want you, if you're interested in this, I want you to go to aneros.com. They have great talks and websites, and no, I won't say research, but they have some people that actually give you their own testimonies, right? So they're telling people what they're going through in terms of reaching and how to reach their prostate, their male G-spot, and how to have that prostate ejaculation or that orgasm, right? Now, if you are not interested, don't do it. But if you are, there is a story about a gentleman. He was like 63 and he had some prostate infection, prostatitis. And so the doctor, one of his doctors, did refer him to get the prostate stimulator. And this is the article that I'm referring to. It's just a great article that does good justice telling you how and telling you the benefits of doing that prostate stimulation, getting that prostate ejaculation, right? So by R.J. Levin, he did his own research in the United Kingdom, and this is just a review in the Clinical Anatomy. If you're interested, let me know. I can send that to you. But he did try it, and what happened to him is he became very addicted to the male G-spot stimulation, the prostate stimulation, and his prostatitis went away after a while, and he said, "Oh my gosh, this is something that he doesn't want to stop doing." And he was eventually able to learn how to do the prostate. I'm going to say ejaculation, but the orgasm through that pathway, because now remember he rewired the pathway. He was able to create that pathway. So even though he stopped using the toys and using the equipment to stimulate the P spot or the male G spot, the prostate, he was able to stop, and then he actually was able to do it without any toy or any stimulation. So he would just lay on the bed, and he could by either, maybe manually thinking about it or manually stimulating the area down there in the perineum, he was able just to recreate that experience and actually have the prostate ejaculation without any manual stimulation of the prostate. So again, this rewiring of the prostate. It's very complex, but very cool. So if you're interested, just go to Aneros, ANEROS.com, and they talk about his examples and have other examples of people that did very well. The other thing I want to point out to you guys is that the orgasm from the prostate stimulation is bigger. Okay, just know that. If you're fine, you don't have to do it. But if you want something more different, you can try it. You are not gay if you love the prostate being stimulated. Your partner, your female, can help you do it. There is absolutely no the gays cannot corner that area, okay, guys? They cannot. That's not theirs. You all have a prostate. Take advantage of it. Enjoy it. And remember that if you're not interested, leave it alone. But if you are, it's just another elevated way of having a more intense orgasm, which will benefit you health-wise in terms of your cardiac function and in terms of your longevity. Remember, 2 orgasms a week, you live longer. So the more intense, the better for both men and women too. And you're going to get that shuddering and that shaking experience, guys. So just remember, you may not ejaculate. You may just have that intense muscular contraction, and you'll find that it's just another experience that you can add to your repertoire, right? But you're not gay because the gays love men, right? So this is not a gay. This is just another erotic zone for you all that you can enhance, learn about slowly, patiently, if you're interested. But I really want you also to remember that your male G-spot that stimulates and can give you great intense pleasure is equivalent basically to the female G-spot. So whatever you think of in terms of whether it exists or not, I think you got to try it before you can make that assumption that whether it exists or not. And when you do locate it, then you're going to say aha, and you're going to know, oh my goodness, now I've learned something that I could help my partner reach, exquisite pleasure and reach exquisite levels of that orgasm, which she might not have been able to reach before, because a lot of women don't even know that they have a G-spot. And remember, not everyone agrees with it. Some people say that they don't exist, but I'm here to say that some women do have it. Again, anatomy is involved, but don't give up. Try it. You need some more advice, let me know. Okay, guys? All right. Nice talking to you. See you tomorrow. Take care.